Lung transplant. This is the most important thing which is happening in respiratory medicine in the world today. Earlier, transplantation was restricted to the Western countries. Now, it has become very common in India, and I can proudly tell you that we at Apollo Hospitals have the most successful lung transplant team in India. We have done in the past nearly about 2 decades, nearly about 230 patients, and our success rates are 60% and more. Now, which are the patients which go for lung transplant? Lung transplant patients are patients which require mostly oxygen, and you are using what is called as home domiciliary oxygen therapy, or LTOT, or long term oxygen therapy, which is you have to use daily oxygen at home. Now, blood pressure in the lungs produces a disease, especially in young women 20 to 30 years old. The only option is lung transplant. This is the second one. The other one is chronic obstructive pulmonary disease, or otherwise called as chronic bronchitis, mostly because of cigarette smoking and air pollution. Air pollution, when you are working in a coal mine, when you are working in a place where there is steel factories, iron factories, anywhere where there is pollution, and you get caught up in your occupational diseases with pollution, you will end up with COPD. Smoking is you are creating internal pollution. Pollution externally produces this problem, and you will end up with COPD, and these are the next category of patients. The next category of patients would be cystic fibrosis, where you are born with a genetic problem where the phlegm in the body is not been thrown out, including the gastrointestinal tract. So, the lungs get affected, and over a period of time you have to do a lung transplant, and sometimes these lung transplants happen along with heart transplants, where there is a heart problem and the lung is affected. So, the heart and the lungs are together changed. Now, these surgeries are done by dedicated lung transplant surgeons who have in their team transplant surgeons round the clock. They have anesthetists and they have physicians who are trained in the state of the art from the Western world, and they have come to India, and they are creating a big revolution amongst people who earlier never used to have an option to live a longer life. Now, once lung transplant is done, they come back to normal life with normal medications and go back to routine work.